appreciate being here. Thank you for having this hearing, and my comments are based on my observation of the presentation you gentlemen did. Very nice presentation, and the questions from the health, the HIE here, I guess. Some very good questions, I thought, in exchange. But what I'm seeing is, I don't want to be critical. I don't want to be step on anyone's toes or anything like that. But I have to say, what I've seen is that a health data intermediary is going to charge for what appears to me to be information management and interaction oversight, which is already being managed. And in most instances, there's not any special cost incurred because it is built into the cost for the providers, for instance, the doctors, the hospital pharmacists, etc., and the payers, the insurance companies, so forth. And the introduction of the health data intermediary, introducing that, also, I think, from what I can see, and from what little bit I know about computers and I'm seeing and what happens with them all, just exposes a tremendous amount of private patient health care information to a very significant possibility of being compromised in various degrees, in some cases great harm come to a patient and individuals will definitely result from this exposure. And finally, well, not finally, I've got a couple of things there. I want to say that the lack of consent, really, practically speaking, it means the lack of payment. And consent really is not it's a meaningless option. It's not really a viable thing to talk about, because if you're not going to consent, the information isn't going to get there, somebody's not going to pay, and we all know that, I believe. One question I do have to you folks, if you don't mind, to kind of try and get this out in one sentence if I can here, but how many health data intermediaries have you approved so far? How many have you not approved? And how many applications do you expect to consider and accept? So that's kind of my comments, short and sweet. We should get through our time limits here.
Thank you. Yeah, with respect to your question, we have approved one certification for a health data intermediary.
Okay.
Ability is the name of the
company.
Ability.
Okay, thank you.
And we don't have any pending applications, but we anticipate that we will be seeing several more through the course of the remainder of the year.
And we can look up Ability's credentials or online.
Correct. Including certification.
And I guess these gentlemen need a chance to come back at me. I didn't mean to challenge you so much, but if you have questions, I'll try and answer them. I'm not a computer expert or anything like that, but I'm just making my observations. So.
Bob, I appreciate the information and your comments as well. And I think, again, expressing the same thing that we've heard many times that we agree with as well as the consent. And I understand your concern as far as anytime information is made available electronically, it now opens up opportunities for other things to happen. So I guess all I can say is reiterating the comments that we made earlier and to share your concern as far as any information that is going from a paper-based system to an automated process, that the privacy, security, and other concerns are addressed. And I appreciate what's going on in Minnesota to ensure that we're here discussing these concerns instead of just basically checking a box and allowing the commerce to happen without going through this process.
Thank you.
Thank you very much.